Go.
So hi, everybody. Mary Jane Burke here, Marin County Superintendent of Schools. So happy to have you. You've heard me say this multiple times, but just as a reminder, this is being translated for anyone who needs translation. So let me stop here for a moment and go ahead and ask Michelle to provide information for those that want to jump onto the Spanish translation.
Thank you, Mary Jane. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Marta Bitton, que es nuestra intérprete esta tarde. Gracias.
Great. Thank you so much. So as a reminder, this will be recorded, available on site, online through the Rethinking Schools within the next 24 hours. So we're excited about that. So I'm going to pass this on to Dr. Santora. So Dr. Santora, thank you.
Hi, everyone. It's a rainy day right now, but we're really appreciative that you're inside and safe and for all you do every day. I'm going to jump ahead. I have oddly good news. Oh, our slide first. So this just shows the cadence of our meetings. Our communications with you and the school community is a top priority. So we have a monthly cycle of meetings, and this is our second to last meeting before we have our meeting tonight with parents. We had some additional meetings this week because of the good news we have about pediatric vaccines, which we'll share a little bit about. So we had a couple extra meetings this week, but it's all on a good note. And you can jump to the next slide. So surprisingly, we are in yellow or moderate levels today. That is not reflecting the COVID-19 activity in our community. That's just what's on the books right now with the Centers for Disease Control. We had our busiest day today and yesterday with the number of new student cases that we're seeing and in the schools, and it's busier than last year because if you remember at this time last year, not all schools were in session. So we broke a record yesterday, and there were 19 new student cases that we have investigated in the school environment. So this is consistent with what we saw last year. We saw a significant uptick right after Halloween, and as I often say, human behavior is very predictable. So once it gets colder and once we have Halloween and other social gatherings, that is what COVID loves, and COVID does find our unvaccinated persons. We just have more unvaccinated elementary school kids. So if you look to the CDC, you'll see that we are being counted as moderate. That's due to a lag of their work over the weekend. And we really are more in a substantial transmission or orange pattern in Marin County right now, but we're officially moderate. So I guess it's semi-good news. You can jump ahead. And that's the uptick that you can see right at the if you look at the December 1st date and from last year and you look to this year, it's the same uptick that we're seeing in cases. Again, it's predominantly driven by our unvaccinated groups, those have the highest case rates, but we are seeing breakthrough cases, especially in individuals who are more than 200 days after their booster shot. So we'll talk about that in a little bit. Jump ahead. And this just reflects that increase of transmission that we are seeing in the community. We had a jump from last week to this week. So we've now investigated 275 cases. I suspect that by the end of when we post on Friday, it'll be 300 cases that we've been investigating throughout the year. And you'll see it's mostly dominated by students, and that's because that's our largest group of unvaccinated individuals. So we have a lot lower amount, we have less cases in staff, which is very reassuring. We did have an uptick in school-based transmission. That's not due to any changes in the risk of school. What we are doing is overcalling it. So for example, we're investigating a sleepover party. A lot of the people who participate in the sleepover are from the same class. We will count, even though it's most likely that they were infected during their sleepover when they were unmasked and not at school. If they are in the same classroom, we will count that as a school-based transmission because we really can't discern. So in some ways, we're overcounting the suspected student-to-student transmission, but we feel that that probably makes up for some of the cases that we're not identifying as part of our investigation. And then what will change, it might change as early as this week when we post on Friday. If you look to the left-hand side, you'll see the percentage of students that are eligible for vaccination. It's just a general students. We'll be breaking that down into two groups, our 5 to 11-year-old group, and then our 12 to 17-year-old group. And that will be based on county level data and not school level data. So we'll be reporting our county level data for the estimate of students vaccinated across the county. We are still requesting that all schools collect vaccination data at the school level. So we could have access to the percentage of the student body of any given school vaccinated, but that will not be posted on this site. You can jump ahead. So for this group, you may have already seen this presentation, and I apologize. I'm going to try and get through the old slides kind of quick. We've been doing like this, I said, since last Monday. Our mask mandate ended on the 1st of November, and that's good news. That's reflective of that moderate to substantial activity that we're seeing COVID-19 in our community. And fortunately, we met all 3 criteria to end the mandate. That being said, when there are substantial levels of COVID-19 activity, it is recommended that regardless of your vaccination status, that you wear a mask indoors. And that is, again, will be your choice, and it is no longer a mandate. And just to also note that nothing has changed in the schools for indoor masking, that everyone, when students are present, regardless of their vaccination, must wear a mask indoors. And just to be prepared when you do travel outside of the area, that there's different mandates. And most importantly, and this is a point that's I think is missed often in the media, if you are unvaccinated and you're in an indoor public setting, you must wear a mask. That is the state order. So if you are unvaccinated, you must wear a mask when you're in a public indoor setting. And jump ahead. So this is just guidance that we're offering to schools and the community at large as they prepare for more meetings and gatherings. I'm describing that there is an uptick in activity. We are seeing breakthrough cases. Then the ways we know how we can control COVID-19 transmission. One, it's not being crowded, so you can consider reducing the capacity of any event to 50%. Face coverings, as I mentioned, are required in schools when students are present. You can always consider limiting attendance to any event to fully vaccinated individuals only. And when you do have an event, we recommend having a list of people that are attending that event. So if there is an exposure at that, if there is a case identified who was present during their infectious period at that event, we can engage in contact tracing and support the identification of individuals who may have been exposed. Jump ahead. So this is just a reminder around our sports guidance. Again, we do recommend sports and other extracurricular activities have higher risk because of exhalation and also close contact. And we recommend limiting participation to only fully vaccinated individuals. If you are going to include unvaccinated individuals in these higher risk activities, you should be following our testing guidance, which is once a week molecular testing or twice a week Binax or antigen testing. All persons playing indoor sports must wear a mask unless it's been determined that there's a choking hazard, and we'll review those activities that there are considered to be a choking hazard. And just a reminder that this requirement requires for any activities that is part of a school, so any extracurricular sports that are part of a school, or even if it's a club activity that is using a school campus after hours, even if it's not a school sport, if it's a group sport. So that is under the state order, because it is in a school setting or affiliated with the school, that's where masks are required. And also because students are present, then spectators, regardless of their vaccination status, must wear a mask. And then this is because we do see that masks are a simple and effective tool for preventing COVID-19 transmission. And it's important, especially with preventing some of the breakthrough cases that we're seeing as well. Jump ahead. So these are the only sports that are identified as having a choking hazard. So competitive cheer, gymnastics on an apparatus, swimming, diving, water polo, and then wrestling or grappling, jujitsu. So these are all things where there can be potential for choking when there is a mask worn. Most notably, basketball and volleyball are not considered sports where choking from wearing a mask is considered a risk. Jump ahead. And just describes shifting out to school performances. So we know we're coming into the season for dance and other recitals. Just recognizing that drama and band are all considered high-risk extracurricular activities, and it's because there's increased exhalation, as I mentioned earlier. And in school performances, there really needs to be a risk reduction approach that's protecting everyone that's engaged in that activity, from the performers to the audience at large. Jump ahead. So again, we recommend limiting participation to fully vaccinated persons only. Just like with sports, that we're expected that unvaccinated and partially vaccinated persons should be tested at least twice weekly. There should be 6 feet distance between all performers and 12 feet distance between the performers and an audience members. And then you're seeking to optimize ventilation when you're having these school performances by keeping the windows and doors open, both during, before, and after performances. And when possible, we're just trying to reduce the number of singers and performers in any given ensemble. So those are, again, kind of common sense strategies to reduce the risk of COVID-19 transmission with these higher risk events. You can jump ahead. Again, spectators or audience members must wear a mask when students are present. Masks must be worn during rehearsals, including all dress rehearsals, and consistent with the guidance. Performers must wear their mask outdoors when they're not actively performing, but a performer on stage, if they're, again, maintaining 6 feet distance when they're on stage and actively performing, may remove their mask for while they're on stage and actively performing. But they must the only ones that can do that are those who are fully vaccinated and have a negative, or if they're not fully vaccinated, they have a negative antigen test on the day of the performance. But again, once they're done with their section of the play, they're backstage, they have their mask back on. Jump ahead. That being said, that's if schools want to continue to require masks at all performances, that is absolutely supported by public health as well as the state. So you do not need to have performances where masks are removed or speeches where masks are removed while they're performing. This is just a jump to our school-based testing. So another difference we have this year over last year is we have higher capacity for testing. Our expectation is that all schools and districts should be enrolled in a state school program. We are here to provide assistance to support testing. We are continuing to endorse symptomatic testing. So we've distributed home testing kits throughout the school community, and that's a great strategy. Again, if anyone does have symptoms, whether they're vaccinated or not, to be able to have a home test to identify if it's COVID-19 or not. We're also engaging in response-based testing where we're going on site to schools 3 to 5 days after an exposure event to provide testing for close contacts. And again, this is a capability that all schools themselves can attain through participation in the state testing program, although public health is here to support that. And then we will begin piloting a test and stay strategy where we can extend modified quarantine for close contacts outside of school. So we'll be working with some schools in as soon as now, actually. We are launching this week testing when there's a close contact, not having them excluded from school, but having them complete daily antigen tests so they can stay in school. All our home tests would be ordered through the county and not through the state. And fortunately, we have more testing supply just because we've had an expiration date has been extended. Mary Jane, do you want to jump on to the next slide?
Yeah, so this next slide provides you the information we have related to the rapid antigen test pilot. So just as a reminder, one of the things that I think has been great about our county is that throughout this pandemic, while we have relied on state or national data, but we've also been securing our own local data. So here's an example of that. So just to give you an idea, all this, when I say Marin County schools, I mean all public, private, independent, parochial schools, that there have been distributed the antigen testing, some that are essentially 40 tests in one packing, and the others that have been the at-home antigen tests. We are not doing surveillance testing. In other words, not testing everyone just in case they might have COVID, but rather symptom-based testing. And so at this point, we have tested 2,391. This is data, by the way, that we look at every single day. So 2,391 staff or students have been tested that have had symptoms. And that is out of 47,000 total, approximately 4,000 40,000 students, approximately 7,000 staff countywide. And you can see the results here that at this point, the data is showing us that we've had 13 positive and 14 inconclusive. So I feel that this is some data that's good for our community, and you have a good sense of sort of where things are. In addition, we're looking at this data to look at the actual symptoms, because when people fill out the information, they actually tell us it was a runny nose, it was a headache, it was a fever. And so we also will be able to extrapolate that data. So every day this comes out, and it, I think, provides good insight into how well we're doing in our county with our mitigation strategies. Thanks.
And this
Lisa.
is very reassuring data for us. Again, it's another tool that we didn't have last year to be able to have home-based testing kits so people can get tested when they have symptoms, and just to see the very low percentage of true positives is also very reassuring. And it's just important for people to know there's a lot of other viruses that are circulating in our community. It's typically our motto is it's COVID until proven otherwise, but don't be surprised if it's not COVID and it's another rhinovirus or coronavirus. And we're only seeing sporadic flu at this point. But again, this is just another great layer of protection that we have for keeping our schools as safe as we can. And again, consistently what we see, the highest risk for COVID transmission is going to come from with your own household, or going to a friend's house, or having your child go to a friend's house for a party or gathering. That's where we're consistently seeing COVID-19 transmission in our community. So you can jump ahead. And this is just where we are tracking. So we have a high level of accountability for this resource. This is still a scarce resource. The reason the Binax kit's expiration date was extended was because there's a delay in production. And then the home-based test kits are even more precious to us because they're in shorter supply than what we call the 40 kits. So the standard clinical kit. So we're just tracking all of the schools, how many kits they've received, the results that we're receiving there, so we can make sure that if they are asking for additional home-based supplies, that the families have been reporting the results. So we're trying to have that level of accountability. And like Mary Jane said, we're not just working with our public schools. You can jump ahead to the next slide. We're also working with our private, independent, and parochial schools. We see this as an all-in-Marin approach and provide the supports regardless if it's public, private, independent, the same supports for preventing COVID-19 activity in a private school is the same as in a public school. And again, that's because we are a very interconnected community. I just finished our soccer season, and so it's a mixture of private school kids and public school kids in some of these higher risk settings. So again, that's why it's critically important that we have a consistent approach across the county. And we're really fortunate to have all of us working together. Jump ahead. So we're just encouraging staff to get booster shots. We are seeing a significant increase in breakthrough cases. In the beginning of the summer, I'd say 25% of our cases were breakthrough cases, and now it's 70% of our cases are breakthrough cases. So even though the case rate or the risk of getting infected is highest among unvaccinated, there is from an absolute numbers of cases, we have more breakthrough cases. So if you are a teacher or your school staff and spend more than 6 months since you've received your vaccine, definitely talk to your healthcare provider or consider getting a booster shot as we move into this last push of the winter season. And there's lots of options for getting that booster shot. Jump ahead. And so this will be our most updated slide. It's not going to be updated until tomorrow. So we've added that 5 to 11 age group. We had a very successful weekend and launch of pediatric vaccines, thanks to our partnership with the Office of Education and all of our schools that are hosting us. We were at Miller Creek last weekend, and we'll be at Strawberry Point next weekend. And we have vaccinated over 2,400 students. And what we're working on now, I just jumped off a phone call. We have a new supply of vaccine. And so we're looking to expand our Northgate site on Saturday, which is our larger site. So we will definitely notify people when we post new appointments for this Saturday. We definitely have a demand for vaccinations in our community. We safely vaccinated over 2,400 with no adverse effects reported from that first group of vaccination. And we know that's a concern in the community. My kids were vaccinated, so it was a great weekend all around, and we are looking to keep that pace as we move through December 18th. Jump ahead. So I was just going to do a quick science, and I apologize for people that have heard this. I know we're in different settings and there's different times this is offered, but we just wanted to share a little bit about the science of the vaccines. And we have, we can add the link to the chat. We have all the recordings from 3 different presentations we've had in the community with leading experts in infectious disease. These slides are taken from Dr. Ted Rule. He's a local pediatric infectious disease specialist. So thank you to you for sharing these slides. So just quickly, just having an overview of the science behind the vaccines that are now available. So the first phase is what they looked at, is seeing what is the best dose for kids. We saw in the early studies when we looked at the vaccine dosing for the 16 to 25-year-olds, and then from the 12 to 15-year-olds, that they had a really strong immune response to the 30 microgram dose. And so there is a hypothesis, and I shared this hypothesis, is that we could give a much smaller dose to children because they're so immunogenic and they have such strong immune responses. So Pfizer tested 3 different doses, 10, 20, and 30 micrograms, and they wanted to find out what is that right dose, the dose that provides the strongest immune response and the lowest amount of side effects. So you can jump to the next slide, which is a busy slide, but you're going to get it. There's two rows. The first row, you're looking at this across, you're going to be looking at the side effects from dose 1 in this first test group. It's around 400 kids. And then the second row is dose 2. And then if you go across, it's going to look, you're going to see 3 different groups. So it's going to be 10 micrograms, 20 micrograms, and then 30 micrograms. And so if you look at the first column, it's fever. So they're looking at the percentage of kids who are reporting fever after receiving that dose. So if you look at the first dose, there wasn't a lot of report of fever in children after they received their first dose. But then if you jump down to that second row, or dose 2, you'll see 100% of the kids had fever after receiving their second dose of the vaccine at that 30 microgram dose. So that seems, again, just a higher level of side effects. And then if you go across and you look at the different columns, you can look at muscle pain. It's highlighted there. And you'll see that this children who received the 30 microgram dose, 100% of them reported muscle pain after receiving their injection. And then only 12% of the children who received the 10 microgram injection reported muscle pain. So again, they're looking for the dose that had the same amount of antibody levels. So whether the children received 10 micrograms or 20 micrograms, it was the same antibody levels. And then with 10 micrograms, they found that it was much less side effects. And you can jump to the next slide. And this is a little more wordy than pictures, but again, just wanted to run through this, where this is a true case control study. So they had over 31 children receive the vaccine and over 1,500 received the placebo. And then they compared the antibody response, and they saw that children who received the 10 microgram dose had actually more antibodies produced than 16 to 25-year-olds who received the 30 microgram dose. So that was very reassuring that, again, even at the smaller dose, there's a strong immune response, which was our hypothesis going in. There was a significantly decreased risk of COVID infection in those who were vaccinated compared to those who were unvaccinated. So over the time that they studied this, from June to September, and this is when Delta was surging. So I think it started in May, from May to September, when Delta was surging in our community. There were 17 cases of COVID-19 found in the group that received the placebo. And remember, that's a much smaller group. And there were only 3 cases of COVID-19 in the vaccinated group. So that is equivalent to an efficacy of 90% efficacious as a vaccine. And from a safety perspective, there were no reported deaths during the study period. Importantly, and which has been a concern, especially after some of the reports that we've seen from the adolescent vaccination experience, there is no reports of myocarditis, no reports of anaphylaxis or a severe allergic reaction. And we saw the most common side effects were fatigue, headache, and diarrhea. And then what my kids had was just that localized injection site soreness. So very, again, this is a safe and effective vaccine for our pediatric population. You can jump ahead. So these are the upcoming dates. As I mentioned, we are already at Miller Creek. We'll be back again in that first Saturday of December at Miller Creek. Our next large clinic appointments will be this weekend at Strawberry Point. And so again, thank you for hosting us. And then we'll be following right before Thanksgiving at Novato High School. And again, all of these clinics filled up right away. We're looking to hopefully launch more vaccine appointments as early as today, if not tomorrow, on our website, and that will be for the Northgate site. Jump ahead. And so also priority for us is having equitable distribution of vaccine. We know we have some schools that have high percentage of students on free and reduced lunch, where many of their parents might be working dual jobs. And so we are partnering with some schools to offer vaccine clinics on site at the school during the school day. This is what we typically do every year before COVID with our flu season. So we're just continuing that. And then we're partnering with the Office of Education to have a special vaccination date for children who are enrolled in special education, who might just need a quieter setting and just a higher staffing level at that vaccine clinic. And jump ahead. Anything you want to add before I jump to holiday gatherings, Mary Jane?
No, I think we're good.
So as I said, we are very predictable as humans. We already saw the uptick of cases as, again, it's gotten colder outside and kids are having sleepovers and play dates and other parties and gatherings. And so we know that this is the season has begun. So holiday gatherings are upon us. So really encouraging everyone who is eligible to get vaccinated, not only for COVID, but our concern is also around flu, that we'll have a potentially a larger flu season, especially if we have low flu vaccination rates in our community. Most critically, staying at home when you're sick. Don't try and tough it out. You could be exposing people to your infection, and we want to keep, again, kids in school. So stay home when you're sick. Considering wearing a mask when you're meeting with others, especially if it's a mix of unvaccinated and vaccinated folks. You can carry COVID-19 without showing symptoms. So if you're not vaccinated, you should consider wearing a mask. Keeping it small still this year. If you're going to have a large gathering, there's just a larger risk of COVID-19 transmission. We saw that with outside lands. We've had some cases reported connected right to outside lands and those other larger gatherings. Obviously, that's much larger, but the smaller you keep it, the lower risk of transmission you'll have. And it's also going to be, you have more space between people. Keep it outdoors if you can. I know today's not a day you think you want to be outdoors, but if it is a nice day, on any of those days that you're gathering with your family and friends, try and stay outside. And again, a tool that we did not have last year that is available is testing. You can have home-based testing. So we would recommend, if you're going to have a gathering, especially with the mixed group, test everyone right before they gather. And so it's going to be a higher likelihood that no one that is infectious is going to be there. And then test after gathering, 5 days after you've gathered, or if you develop any symptoms. And that is the common scenario we hear every day. Of the 19 cases that we are investigating from today, it was a gathering, a private gathering that people had with unvaccinated kids. The index case didn't have any symptoms, or they thought they just had allergy symptoms. And then we have now multiple kids who have tested positive for COVID-19. And that is the consistent pattern. And the most importantly, if it's a positive test and you take an antigen test, believe it. A positive antigen is probably going to be a positive test. So if you can get a test, a reflex confirmatory test, that's okay, but still don't go to the gathering if you have a positive antigen test. And then don't forget the basics, washing your hands. That's probably what people are forgetting the most. They're not washing their hands like they used to, or covering their cough. So don't forget the basics that still protect us from getting sick from anything. Jump ahead. So they've updated their travel guidance at the CDC. We know a lot of people travel during the holiday season. Still recommended for domestic travel to delay travel until you're fully vaccinated. If you're not fully vaccinated, you should be following the CDC recommendations, which is getting a test before you travel, while you travel, wearing a mask, and it's also required on many forms of travel. So while you're in an airport or on the plane, you should be wearing your mask. And then after you travel, if you're unvaccinated or you're not fully vaccinated, you should get tested and stay home in quarantine. The only ones who have an exception for quarantine who are unvaccinated are students, and they are allowed to be in school on a modified quarantine where they must test on day 5 to complete that. And if they do develop symptoms while they're on quarantine, they need to stay at home. Jump ahead. So international travel, it is not recommended to travel at all until you are fully vaccinated. You should not be traveling if you've been exposed to COVID-19 unless you're fully vaccinated or you've recovered within the past 90 days. That means you have either acquired or natural immunity. So if you're identified as a close contact, you should not be traveling. We do have do not board lists that we coordinate with the CDC and our local airports. So that's not to engage with us on that front.
Wait,
If you're-
Lisa, say
Yeah.
that again. What do you have? Do
It's
not
called do
board.
not board lists.
Oh,
So
do
if
not-
you're identified as a close contact as part of our contact investigation, and we identify that you were planning on traveling, we will be encouraging you to reschedule. And if we have any concerns that people are not rescheduling, they would be placed on a do not board list. So
Wow.
it's less common because more people are vaccinated now, but that was one of the roles that we play in public health. You can't if you've been tested positive and you cannot get on a plane during your isolation period, or you'll be on that do not board list. And also if you feel like you have symptoms and you're waiting for results, you shouldn't be traveling either. Again, this is the second to private gatherings as a cause of COVID-19 transmission in our community is travel. So either we're hearing people are getting sick because they've gathered together, or they're returning from a trip, usually from another state that has higher COVID-19 activity than our community. You can jump ahead. So unvaccinated persons, now it's going to be harder for you to return into the United States. You have to have a test done basically no more than a day before your flight is departing from the foreign country back into our country. The only exception to that is if you have a history of past infection, and we'll share these slides. It's a little more detailed, that you have documentation that you've recovered from a COVID-19 infection. Notably that the testing requirements are not for children under the age of 2. If you're partially unvaccinated, again, you should be tested 3 to 5 days after you returned. You will be on quarantine unless you're a student, and then you can follow a modified quarantine, but you must get tested on day 5. Jump ahead. Fully vaccinated persons, they give you a little more slack. So if you're in Mexico, you can get tested up to 3 days prior to returning to the United States. But you need to be able to show proof that you're fully vaccinated. We still do recommend getting tested after returning from travel, even if you're vaccinated, because of the breakthrough cases that we're seeing from this Delta variant. And like I said, number 1 is private gatherings for the cause of COVID-19 transmission. Number 2 is travel, and just to monitor for symptoms. So you don't need to quarantine, and fully vaccinated students and staff don't need to be on modified quarantine, but you should monitor for symptoms because there are breakthrough cases. And there's reinfections too. Unfortunately, what we also see with natural immunity, it's people that were infected with COVID a year ago, your immunity has also waned. So you also have a risk for reinfection. So we're not only seeing breakthrough infections, we're seeing reinfections with the Delta variant. Jump ahead. And then there's just this new guidance around those who have recovered. If you have recovered and we just have more people who have recovered with the Delta variant. So if you have recovered within the past 90 days, you are not required to get tested. Unless you do have new symptoms, then you should consult with a healthcare provider. And it's almost like if it's been 90 days, within 90 days of a COVID-19 infection, you basically have the same treatment as someone who is fully vaccinated. So you don't need to self-quarantine either after travel. But we would recommend people that have recovered from COVID-19 also get vaccinated. You have significantly enhanced protection if you've had COVID-19, if you also get vaccinated. Jump ahead. There we go.
Okay,
We got through
Lisa.
it.
So Lisa, a couple questions right off the top. If you're recommending now that people have vaccination boosters, when am I considered fully vaccinated?
You're fully vaccinated 2 weeks after your second dose of your initial series.
So you don't have to
So
have
the
a booster.
boosters does not play a role into be considering fully vaccinated or not. But especially with our elementary school staff, because we are seeing, again, this is our highest week of increase in infections in a while. It just shows how Delta is circulating in this unvaccinated population. We would recommend that school staff get their booster shots.
Okay, so next question, why won't data be shared about vax percentages?
Well, they should be shared. So each school should post their individual school level data around the vaccination rate of their students and the vaccination rates of their staff. It's just on the back end of that dashboard that you see, it's hard. If you can imagine, there's 116 schools to get school-specific data as we're vaccinating and vaccinating and vaccinating. So we have in our 30-point guidance, the expectation is that schools would update their individual school data around vaccination of staff and students on a monthly basis. So you should have access to school level data. It just won't be on that particular dashboard.
So there's several questions about the data. How are the differing standards between business and government standards being reconciled? And I'm not sure, Lisa, if that means, for example, here at the county office, no students present, 100% vaccinated. People don't need to wear masks, let's just say, as opposed to at a school site with students present.
Oh, so it's up to the school level policy. So schools can follow when students are not present and it's a school business meeting with only school staff in attendance. If they want to follow being mask free, that would be a school level choice. But once a student enters the room, masks are on for all. So there can't be any mixing. It could be, that's where a school can be treated as a business. A school may opt for good role modeling of behavior for their students to continue wearing a mask, especially now. Today, we're not in substantial, we're in moderate levels, but I really believe it's actually substantial because of the number of cases we're seeing daily right now. That's not included in the CDC report. The recommendation from the CDC when there is substantial activity is to wear masks regardless of your vaccination status when you're in a public indoor setting. Choice though. So if that's, again, that you'll see some discrepancies between businesses across the community. So for example, right now, Target is still following corporate policy around requiring masking indoors. That is their right. Or you can go into a smaller grocery store and they're following the county rule where there is no mandate in place. So there will be variability, and that's why we would just recommend everyone have a mask in their car or in their pocket. So you're prepared, depending on the entity you go in, to follow the cultural norms of that organization.
Mm-hmm. So Lisa, there's another question about data. How is the data being monitored, validated, and verified?
We have a team of, well, that's a great question. So we have reporting that comes in different ways. So we have, for example, you saw one place we report where we have a Google document that collects data around home tests. We have then a county JOT form, we call it, that collects data around non-school home tests. We have a system called CalReady, where we get a report of all laboratories across the country who have a positive test have to report all positive and negative tests into the state of California. And then we have a team that basically does surveillance on all daily new positives to identify if they're prioritized based on their age. So if they're school age, they're entered into our top priority list. And then we identify, but based on interviews, if they work in a school setting or another high risk setting. And so we have 3 teams that are working together. We have we have 3 teams working together on the school front. We have our schools team that works directly with the schools and gets the report of students who test positive. We have our contact investigation team that investigates once there's any positive test that comes into the community. Then we have our CD lead team that's processing all of those and making sure they're distributed and identified. And then we have a weekly meeting to reconcile, to make sure all those results are reconciled. And then we have dedicated epidemiologists who are reviewing all of the data and identifying basically for quality assurance measures to make sure that we're capturing all the newly reported positives. So for example, we found out they're going to see an uptick in cases that's on our school dashboard because if you can imagine, we did all the work and everyone was identified and cases were contacted, but they weren't added to our tracking mechanism. So this week, as part of our quality assurance process, we identified cases that weren't being counted. So again, there's just layers of I guess controls to ensure that we're accurately reporting our data.
Okay, so if someone is identified as a close contact from a school exposure, then tests negative, are they still prohibited from international travel boarding if it's within the 90 days window? Person is fully vaccinated.
Oh, they're fully vaccinated?
Yes.
Then they could travel.
Okay. All right. So several recommendations that we're talking about using antigen testing. So where do you get the tests, and are there a particular test that you recommend?
Binax is, I think, the best test on the market. It's harder to get. They are available. So you can get them at CVS or Walgreens. Sometimes Amazon. They can be a little bit pricey. That's why we do have the home-based testing available through our program with the schools. But for private use, you should be able to get it online or at one of your local pharmacies. The last I heard, the Walgreens on 3rd Street in San Rafael had Binax.
And Lisa, it's running about $25.
And it's 2 tests.
Okay. All right. Does a vaccinated person who has flown need to get a viral test 3 to 5 days after flight, and also an antigen test day of gathering?
Yeah, I would. So if you want to have the lowest, so these are just layers of protection. So that is the recommendation. Traveling is a higher risk activity, being in an airport, being on a plane. So it's just the process of traveling is a higher risk activity. So we would recommend, it's not required. So it's not required that you get tested if you're fully vaccinated. It's just recommended. And again, we recommend it because we do identify cases that way. And just a lot of people forget that COVID-19, people can be asymptomatic or have very mild symptoms with COVID-19. We have a range. Some people have very severe disease, especially for over the age of 50. Some people even over the age of 50 may just have mild disease. So it's the risk activity itself, which is why there's the recommendation that you get tested. So I myself had traveled. I was fully vaccinated. When I returned from traveling, I tested my whole family. We actually tested ourselves a couple of times because we developed sore throats, which didn't end up being COVID. It was just something else, but we just tested.
Mm-hmm. So Lisa, this person was just in the store and in Novato, and the owner said that their 13-month-old is required to wear a mask in the store. Does a private owner get to decide their mask policies? No.
My understanding is, I'd have to double check, but under 2 years old, masks are not required in this state.
Right. Okay.
Because of the choking hazard. So if you want to email covid19@marincounty.org, I'll put that in the chat, and just we can reach out to the business, and we would do it privately. But anyone under the age of 2 is not required to wear a mask because of the choking risk.
Right. And then this person went on to say, "Thank you for all you do. Couldn't do it without Lisa and the health department team." Thank you, Nikki Fletcher. Okay, next. How long past so this is about Binax tests and the expiration dates and the extension. So how long past expiration date on a Binax test is valid?
So now it's a year past the date that's originally on the box. So it was extended 6 months, and then it's been extended 6 months again. So I think so. The ones that were expiring October 29th were already extended. So the date on the box probably was like an April or May date. And now it's been extended again. Mm-hmm. And we're not concerned about that because if the expiration dates, we're very short expiration dates, and we're using the test ourselves, and they're still performing well.
Mm-hmm. And Lisa, you're talking about both the tests of 40 and the Binax home tests.
Yes.
Okay. Okay. This is a preschool parent, wants the child to return from a cold congestion with a negative test, but still has a runny nose and cough. They want the same modified return as elementary schools have. You can't go back to school with a runny nose and cough, right?
It's up to the school policy, but if there's a negative test and the child's improved, then they can return to school. It probably depends on the preschool itself, how comfortable they feel with having runny nose kids. We have both. I'm aware of both groups. There's groups that are ready to take runny nose kids back, and there's schools that are have staff that are more concerned, but with the negative tests, as long as the child's improving and feeling better, they can return as long as it's consistent with the school's policy.
This is about travel rules for flying. Does it apply to driving to San Jose, Los Angeles? No. You have to use words, Lisa.
Oh, no.
Right, we're back to preschool. Use your words. You're
Use
just
your
shaking
words.
your head. They might not hear you. Okay, so the answer is no, it doesn't apply to driving, right?
It does not apply to driving. So
Okay.
what we consider domestic travel would be travel on a plane to Arizona or out of state. But if you've engaged, again, if we are recommending, if you go to a large private gathering, we're recommending that you test 3 to 5 days after. So it's really just knowing your risk. If you think you've done something risky, like going to outside lands and you get a sore throat, get tested. You know, if you've been to a large family gathering and get tested 3 to 5 days after. Even if you're asymptomatic, if you engage in a high risk activity, we have testing widely available. It's better to know than not know. And again, it's circulating in our community. So it's just, especially again with staff who are around, staff and families who have elementary school kids, that's where COVID-19 is circulating, consistent with what we would expect. The virus finds unvaccinated people. And now we know it's traveling in that network too. So that's the other thing. So it's traveling in this kid network. So it doesn't take much to jump from one town to another or one social group to another.
Lisa, when will we have herd immunity?
We are estimating it to be 85%. And so vaccinating our children should bring us to what we would consider a herd immunity. If we achieve our goal of vaccinating 75% of our 5 to 11-year-old population, then 85% of our total population would be vaccinated. That's consistent with what is seen with measles, which is a very contagious disease. Our biggest risk is mutations that allow breakthrough from the vaccine. And again, what you are seeing with the Delta variant is there is some breakthrough. The best news, and most importantly, is though people that are vaccinated are not getting hospitalized. We don't have severe disease. We only have 2 people in the hospital right now in Marin County for COVID-19. So again, that data just really supports the value and importance of vaccination.
So if you're for an outdoor holiday gathering with unvaccinated teens and vaccinated adults, should masks be worn outdoors?
It's not required outdoors, but if you're hugging, so you can get COVID outdoors, it's less likely outdoors. The closer you are, the more hugging and kissing there's higher risk of COVID-19 transmission. But it'd be a good time to talk to those family members and friends about potentially vaccinating their teens.
Okay, so this is another preschool question. Can preschools blend cohorts at this time? Should parents enter the school to pick up or drop off at this time? If a parent becomes positive, would we need to close the cohort?
You can blend. The risk of blending is if there's a positive case, then 2 cohorts would be affected. Parents can drop off and pick up, and that's okay. That we do have a case we're investigating where some parents are like classroom parents and really are engaged in the care and teaching of a preschool group. And then if that parent tested positive, then we may have to close a cohort down. But that parent would have to be having close contact, which again, as you remember, is 15 minutes of contact less than 6 feet. So if it's just a parent coming in and picking up and dropping off, which usually happens probably for most parents in hopefully it's only less than 5 minutes. I've been on the other side where it's been more than 5 minutes, but those type of contacts, we wouldn't consider an exposure at all to COVID-19, even if that parent tested positive.
Okay. All right, Lisa, I think we're there. We're done with these questions. So just wanted everybody to stay on for a minute. We have a quick video for you. Just to note that starting in January, we're going to move the time of this meeting to 3 o'clock as opposed to 1 o'clock. And we're going to start to consolidate the number of these type of conversations that we're having. So I will definitely start that in January, but I just want to have everybody just sit up tall, take a deep breath, and know how much we appreciate all of you and all you've done on behalf of our kids, and just consider this a happy Thanksgiving moment.
Everybody gets a heart, everybody gets a soul, everybody gets a mind to let them know that we can be smart, and we can be kind, and we can be living by giving and loving all the time. So on the days when it's feeling tough, and it seems like you don't have enough, well, let's be thankful for our friends and family, and grateful for the air that we breathe, and appreciate everything that we have today. Let's be generous to anyone who has less than us. It's good to be compassionate, 'cause ever since the day you were born, yeah, we've got a lot to be thankful for. Yeah, we've got a lot to be thankful for.
Okay, so you get the gist, right? Thanks everybody for everything that you've done and will do, and happy Thanksgiving to everybody, especially Lisa, to you and your team and my team at the Rethinking Schools. You guys are amazing. Bye everybody. Happy Tuesday.
Thank you.